Hello everyone, this is Dr. Diana Prem, Assistant Professor from the Department of Oral and Maxillofacial Pathology, Vinayaka Mission Sankaracharya Dental College. Today I am here to present a topic on permanent maxillary first and second premolars. Maxillary premolars. So the learning outcome of this lecture would be the student listening to this lecture should be able to identify and enumerate the functions of a maxillary first and second premolar, describe the morphology of each surface, especially the occlusal pattern, identify and name the anatomical landmarks, basically the cusps, the fossas and the grooves that are present on the each surface of the tooth, and the number and names of the roots that are present, and also to differentiate between the first and the second premolar. Premolars, they are otherwise called as the bicuspids or a transitional teeth located between the maxillary canines and the molars. In humans, there are 8 premolars, 2 in each quadrant. They have at least 2 cusps in each premolar. They have the properties of both the canine and the molars. If you see this picture, this shows the yellow color marked teeth are the incisors. They are present in the primary dentition as well as in the permanent dentition. Those that are present marked as orange color are the canines. These teeth are also present in the primary dentition as well as in the permanent dentition, whereas the molars are marked as violet color and they are present both in the primary and in the permanent dentition. Whereas when we come to the premolars, the pink color marked teeth, they are present only in the permanent dentition and they are not present in the primary dentition. That is one speciality of this maxillary or the mandibular premolars. According to the numbering system, 3 types of numbering system, the premolars are numbered as 1, 4 and 1, 5. That is maxillary first premolar is called 1, 4 according to the FDI numbering system and 1, 5 as the second premolar. Coming to the second quadrant, that is the upper left quadrant, according to FDI number, the maxillary first premolar is 2, 4 and maxillary second premolar is numbered 2, 5. Based on the universal numbering system, as we know, the numbering starts from the right quadrant, upper quadrant to the left quadrant. The teeth are numbered 1 to 18. So based on that, the universal numbering system, the second premolar, maxillary right second premolar is numbered 4 and maxillary first premolar, right first premolar is numbered 5 and the maxillary left first premolar is 12 and maxillary left second premolar is numbered 13. Based on the Zsigmondy-Palmer system, there is quadrant is differentiated with the L line, opposite and regular L line, and the teeth are numbered the same. The maxillary first premolar is number 4 in number and second premolar is number 5. So during the eruption, they replace the molars. As the premolars are not present in the primary dentition, the molars of the primary teeth are replaced by the premolars of the permanent teeth. Coming to the functions of the premolars, the first premolar, the functions like the canine because it is adjacent to the canine teeth. It functions like a canine in shearing or cutting the food, supporting the corner of the mouth. Whereas the second premolar basically has the functions of the molars for mastication and to maintain the vertical dimension during the occlusion. Chronology. Chronology is nothing but the evidence of the events that are happening. Like the chronology is the age or the eruption or the root completion time or the calcification time that occurs during the life of a person. So maxillary first premolar, the calcification starts 1 to 1.5 years of age. The crown completion happens by 5 to 6 years and then the eruption is complete by 10 to 11 years of age, and the root completion is by 12 to 13 years of age. The difference between the maxillary first and the second premolar is that 1 year advanced for maxillary second premolar when compared to the maxillary first premolar. In all aspects, calcification begins by 2 years of age, crown completion by 6 to 7 years, eruption by 10 to 12 years, and completion of root is from 12 to 14 years of age. Coming to the dimensions are almost the same for the maxillary first and the second premolars. Now let us describe the tooth from each aspect of the tooth, that is the buccal aspect, the palatal aspect, the mesial and the distal aspect, occlusal aspect, and the root separately. So moving on to the buccal aspect, the crown is the broadest at the level of the contact area and narrow at the cervix. So this is the shape of a maxillary first premolar from the buccal aspect. It is trapezoidal in shape. It is broader at the incisor level and it keeps converging when it moves to the cervical line. The buccal surface is more convex and there is a very prominent buccal ridge present on the maxillary first premolar, whereas this is absent in maxillary second premolar. The buccal ridge is very less prominent. The other features in the maxillary first premolar are the crown length. The crown length is little bit longer or appears to be longer. By measurement it is same, it is 8.5 centimeters in length, but it appears to be longer when compared to the maxillary second premolar. And the mesiodistal width is also widest in the maxillary first premolar when compared to the maxillary second premolar. The cusp tip is slightly moved or displaced distally, which creates a longer mesial slope. This being the mesial aspect of the tooth, this is a longer mesial slope compared to the distal slope, which is just the opposite for the maxillary second premolar. The prominent buccal ridge on the first premolar along with a mesial depression. There is a mesial depression much appreciated in the maxillary first premolar, which is not present in the maxillary second premolar. Moving on to the other aspect, the palatal aspect. From this aspect, both the maxillary cusps will be seen from the palatal aspect, and the root portion of the maxillary first and the second premolar seems to be tilted distally in case of the first and second premolars. So from the palatal aspect, the lingual cusp seems to be smaller in size when compared to the buccal cusp. That we will be discussing again under occlusal aspect also. So for now, to appreciate the aspects of the maxillary first and second premolar from the palatal aspect, the crown seems to be narrower on the lingual aspect than the buccal aspect, and it is more convex, and then the mesial and the distal slopes are at 90 degree, and the cusp tip always bends towards the mesial side. This is the cusp tip that is bending towards the mesial side of the arch. So this might be the appreciating feature to differentiate between a right and a left tooth. That is, there is a mesial tilt of the cusp tip of the first and second premolars. This is one differentiating feature of the two teeth. Moving on to the mesial and the distal aspect of the first and the second premolars. From the mesial aspect, the landmarks that you will be able to appreciate are the buccal cusp and the lingual cusp, a longer buccal cusp and a shorter lingual cusp, and a more prominent depression which you will be able to appreciate is called as the canine fossa or a prominent concavity. There is another concavity on the root surface of the mesial aspect that is called as the mesial depression on the root, which is more marked in case of a maxillary first premolar on the mesial aspect, which is absent in case of the distal aspect. The depression on the root is absent, and the And canine fossa or the concavity seen on the cervical portion of the crown is also absent on the distal aspect. Why? The reason is the presence of canine that erupts later than the maxillary first premolar in the maxillary arch. So the crown portion of the canine is impinged over here. So that creates a depression on the cervical portion, giving the name as canine fossa for this depression in case of the maxillary first premolar on the mesial aspect. Okay, so this is another identifying feature from a right and the left maxillary first premolar. The other features are, again, there is a longer, even from the distal aspect, there is a longer buccal cusp and a shorter lingual cusp. Another feature is the distal marginal ridge. Okay, that is present more cervical. The distal marginal ridge is present more cervical to the on the distal aspect when compared to the mesial aspect. It is more occlusal in case of a mesial aspect of the first premolar. Whereas in the second premolar, most of the features are the same. That is, the distal marginal ridge is more cervical on the distal aspect when compared to the mesial aspect, and then the depression is more prominent, the opposite of the maxillary first premolar. The root depression is more prominent on the distal aspect than the mesial aspect, whereas just the opposite is in the maxillary first premolar. The mesial side has more deeper depression when compared to distal, whereas in second premolar, the distal aspect, the depression is more prominent when compared to the mesial aspect, and the crown seems to be of equal length in case of a second premolar. Another important feature, identifying feature, is the two roots are visible on the mesial and the distal aspect of maxillary first premolar. Two roots are visible on the distal and mesial aspect, whereas the maxillary second premolar is a single rooted tooth. And the bifurcation of this root is towards the apical third. It is more towards the apical third of the root. Coming to the cemento-enamel junction or the cervical line. Okay, the cervical line on the mesial and the distal aspect is more concave. On the mesial and distal aspect, whereas on the labial or the palatal aspect, the cervical line is more convex towards the apex of the root. Moving on to the most important and the explanatory aspect of the premolars or the occlusal aspect. There are numerous landmarks that are present on the occlusal aspect of the maxillary first and the second premolar. Measurement wise and the anatomical landmark wise, both are having same anatomical landmarks with little bit differentiation in case of the maxillary first and the second premolar. The occlusal aspect is more wider cervico-lingually than mesio-distally. That is, it is wider from buccal to the lingual when compared to the mesial to distal diameter. That is one feature in case of both maxillary first and second premolar. Among this, the mesio-distal width is more wider from the buccal aspect is more wider for a maxillary first premolar when compared to the width of the maxillary second premolar. And the crown is hexagonal in shape. The crown is hexagonal in shape in case of a maxillary first and second premolar. And when you see the surface anatomy, you can name the features as elevations and depressions. Elevations are mostly the cusps and the ridges that are present, and depressions are the grooves and the fossas that are present. Based on that, maxillary first premolar has a prominent buccal cusp, and a more prominent lingual cusp. Two cusps are present, buccal cusp and lingual cusp. When coming to the buccal cusp, there is buccal triangular ridge. This is the buccal triangular ridge. Okay, this is the lingual triangular ridge. These two ridges join together forming the transverse ridge. So these are the elevations seen on the center, and the other elevations are the mesial and distal marginal ridges. Mesial marginal ridge and distal marginal ridge. Okay, so these are the elevations that you will be able to appreciate. Coming to the depressions that you will be able to see are the most importantly the central groove that runs between the mesial and the distal aspect on the center of the crown. And the other depressions are the two fossas that are present, the mesial triangular fossa and the distal triangular fossa. The mesial triangular fossa and the distal triangular fossa. So these are the anatomical landmarks that you will be able to appreciate in a maxillary first and the second premolars. Both the premolars you will be able to appreciate all these features. And one another extra finding in the maxillary first premolar are the supplemental grooves. Other than the central groove and the other developmental grooves, there are numerous supplementary grooves present in the first and second premolars, where the second premolars has extra number of supplementary grooves when compared to the maxillary first premolar. Coming to the root, which is the most important factor in case of a maxillary first premolar, is that it is bifurcated, and the bifurcation is mostly on the apical third of the root, apical third. As you know, the tooth root will be segregated or divided into three components: cervical third, middle third and apical third. So the bifurcation is at the apical third of the root, which is the most important identifying feature for a maxillary first premolar, because in any premolar there is no bifurcated root. The only premolar with a bifurcated root is the maxillary first premolar. All the other premolars, the second maxillary premolar and the mandibular first and second premolars, are single rooted tooth. Okay, that is the most important aspect of a maxillary first premolar. Okay, so and the names of the roots are also important. So the maxillary first premolar has two roots. One is the buccal root and the other one is the palatal root. So during carving, the cusp tip is in one line with the center of the buccal root, and again the cusp tip is in one line with the center of the lingual cusp. Lingual cusp tip is also in line with the tip of the root, and the buccal cusp tip is also in one line with the tip of the root. So the bifurcation is apical, as I said already, and then the second premolar is single rooted tooth. So let us conclude with the differentiation between the maxillary first and the second premolar. There are certain features which are that shows marked difference between the maxillary first and second premolar based on the anatomical landmarks and the shape. First and foremost, the shape of the maxillary first premolar is hexagonal in shape when compared to the second premolar, which is ovoid in shape. Another feature is the supplemental grooves are less in number in maxillary first premolar, and in second premolar they are more in number, giving a more wrinkled appearance to the occlusal aspect of the maxillary second premolar. The next point is the mesial marginal groove, which is very marked in case of a first premolar, which is less prominent or sometimes absent in case of the maxillary second premolar. The buccal ridge is again more prominent in first premolar, and it is very less prominent in second premolar. From the mesial and the distal aspect, the buccal cusp seems to be longer or larger when compared to the palatal cusp, whereas in second premolar both the cusps are of equal height. That is one difference. The major difference, that is the most important striking finding, is the last but not the least. The maxillary first premolar has two roots, that is buccal and a palatal root, whereas the maxillary second premolar is single rooted tooth. So with this, I appreciate that you will be able to identify a maxillary first premolar and a second premolar, and the landmarks that are present, and how to differentiate between a right and a left tooth, and also from the first and the second premolars. Thank you for watching.